Good evening, everyone. I'm Jessica, and this is my research proposal on how vitamin D deficiency impacts depression in obese women. The nutrient of interest is vitamin D. Vitamin D plays a major role in how the body functions and even helps prevent chronic diseases and illnesses. 50 to 90% of vitamin D is processed through skin exposure to sunlight. The rest of our daily intake can be consumed through food. 15 minutes of sun exposure can decrease one's risk of becoming vitamin D deficient. Optimal levels are considered above 30 nanograms per milliliter. For this research study, I am investigating the role of vitamin D deficiency and how it plays in treating depression symptoms in obese women. Obese individuals have lower levels of vitamin D, consistent with being deficient, than those who were considered overweight and those who were categorized at a normal weight. Rates of depression in obese individuals are up to 25% more than those who are not obese. Women were almost twice as likely to be diagnosed with depression than men. These reasons alone warrant further investigation into these issues. My research question for this proposal is, will having levels of 25-OHD increase above 20 nanograms per milliliter improve symptoms associated with depression in obese women with a BMI of 30 to 34.9 and are between 30 to 40 years old? Body mass index, also known as BMI, can be classified into three categories. For my population group, I have chosen to look at women who are classified as a class 1. Their BMI would range between 30 to 34.9. The objectives of this study are to investigate the relationship between vitamin D deficiency and depression in obese women. We will also determine if increasing 25-OHD levels in obese women will alleviate depression symptoms. The hypothesis of this study is that when vitamin D levels are increased above 20 nanograms per milliliter, there will be a change in obese women's depression symptoms. Current literature is researching how vitamin D impacts one's body mass index. It has been suggested that vitamin D stores in the adipose tissue, and obese women may need higher doses of vitamin D to increase their levels to optimal. 41% of adults are considered vitamin D deficient in the U.S. This means that their 25-hydroxy vitamin concentration is below 20 nanograms per milliliter. Additional research is associating decreased levels to a higher percentage of fat mass. However, studies have found that increasing one's levels can aid in weight loss and maintenance. With obesity rates being at an all-time high, physicians are seeing a rise in other health issues associated with obesity. For example, 322 million people are affected by depression. Current research is investigating the use of vitamin D to prevent and treat depression. One study found evidence that weight loss prompted by outdoor physical activity would increase their levels of 25-OHD by supplementation. This will aid in subsiding their depression symptoms and aid in weight loss. However, there are at least 9 cross-sectional studies that have not found a significant link between vitamin D and depression. By continuing to examine the relationship between obesity, depression, and vitamin D deficiency, it can help develop an action plan to begin to reverse each health disparity and the damage to one's overall health associated with each one. Since there are many conflicting research studies that debate if increased levels will help subside depression symptoms, there needs to be an additional research to determine if vitamin D has a causal relationship with depression or if there is a more intricate relationship between the two. For this study population, at least 54 participants are needed. There are certain inclusion and exclusion criteria that they must meet before qualifying to participate in the study. For the inclusions, they are female subjects between 30 to 40 years old. Their body mass index is going to be between 30 to 34.9. They need to score higher than 30 on the Beck Depression Inventory test, and their vitamin deficient status will be under 20 nanograms per milliliter. For the exclusion, they cannot have taken any supplements within the last 3 months of vitamin D. They cannot have recent weight loss. They cannot have used a tannin booth within the last 3 months. They must be diagnosed with clinical depression, and they cannot have visited any tropic areas within the last 3 months. This is on both sides of the equator, and that is between 23.5 latitude south and 23.5 latitude north. Prior to being accepted to the study, the admissions director at Prisma Health will review the informed consent with patients and have them sign a copy. Patients will be given a copy to keep for their record. It'll discuss the age criteria. It'll explain that there is little to no risk involved in the research study. The study will take 12 weeks to complete because at this time there should be an increase in their levels. Participation is voluntary, and subjects may withdraw from the study at any time without penalty or punishment. Files are password protected and only given to the researchers to analyze their results. There is also a incentive to participate of $50 Visa gift cards, and they will also receive a 6-month free vitamin D supplement. Also, the informed consent will discuss possible side effects, risk, and other considerations such as possible physical and psychological harm, pain, or discomfort. As with any research study, there are risks that the participants might be subject to. However, the benefits outweigh the risk. Some of the risks include developing a hematoma or infection when their blood is drawn. Also, patients may not be compliant with taking their vitamin D supplements. This population is also considered vulnerable as they are depressed. And with a self-administered test, patients may not always be truthful on their Beck Depression Inventory test. The benefits are they will be monitored and cared for by licensed physicians, and there's an incentive to participate. There will also be resources available for patients who have thoughts of suicide. They will also be given the option to opt out of the research study. However, they can stay in their weight loss program at Prisma Health. That way they still can be monitored by the licensed physician. By participating in this study, patients will have a greater chance in correcting their vitamin D deficiency, which will in turn aid in subsiding depression symptoms and potentially help with weight loss. Once the patients are accepted to the study, we will use the following methods to evaluate their BMI, vitamin D, and depression statuses. These will be reevaluated after the 12-week intervention to see if there's any improvement in their status. Upon completion of the study, statisticians from the University of South Carolina will analyze the data. They will use an independent t-test to see if there's a significant difference of the Beck inventory scores between the baseline at the beginning of the intervention and then also at the end of the intervention as well. They will also use a correlation of coefficients to determine the relationship in strength between other variables such as BMI and vitamin D levels in relationship to the patient's BDI scores. The data will be reported electronically. The anticipated results are that when 25-OHD levels are increased and the fat mass is decreased, the symptoms of depression will be alleviated. The findings of this study will allow individuals to gain back control over their mental and physical health. This concludes my presentation. Thank you and enjoy your evening.